Hi, my name is Olivia Rubio, and I'm a student in the concurrent Adult Gerontology Nurse Practitioner Master's and PhD nursing program. And my poster is a patient-centered advanced care planning intervention across the aging continuum, a review of literature relating to respecting choices. So, advanced care planning conversations have been shown to improve discussions surrounding end of life, improve these conversations between healthcare practitioners, patients, and caregivers, reduce hospital utilization and cost at the end of life, and increase congruence with end of life decisions between patients, their caregivers, and their healthcare providers. However, these end of life conversations often happen too late in a chronic disease process or at inopportune times, leading to a lack of patient engagement. And so we were really looking at intervention that addressed advanced care planning conversations in a stepwise process and met patients where they're at in the aging process or their chronic disease process. And so we found Respecting Choices did this. They have 3 steps called first steps, next steps, and advanced steps. So first steps is when maybe a patient has just been diagnosed with a chronic illness. They don't have any functional impairment, and they're not ready to have a serious conversation about end of life, but they're open to talking about their long-term health goals and maybe some end of life decisions. And then next steps is when a patient has maybe 2 or 3 chronic illnesses, they have more functional impairment and experiencing more frequent hospitalizations. And so we're looking to have more serious end of life conversations and maybe give them knowledge about advanced directives. And then advanced steps is when a patient is in their last 1 to 2 years of life. We're looking to have serious conversations about end of life and making sure that the patient has an advanced directive in their medical record or physician orders for life-sustaining treatment. And so our review of literature was looking at the feasibility of the Respecting Choices intervention to be used in a study that it looks to improve advanced care planning conversations, looks at its impact on caregivers, and also looks at whether it increases the health knowledge surrounding advanced care planning. And so we looked at 3 databases, PubMed, CINAHL, and Google Scholar. And we found 12 articles based on our eligibility criteria. And all 12 articles found a positive association with the Respecting Choices intervention, such that it increased patient satisfaction and engagement, and increased the knowledge surrounding advanced directives. It increased congruence with end of life decisions with patients and their caregivers and healthcare team. And it also decreased the stress on surrogate decision makers with end of life choices. And lastly, it increased the completion of advanced directives and physician orders for life-sustaining treatment and their availability in the medical record. We did, however, find some limitations with all 12 articles, such that they lack diversity in the patient population that they used. Also, geographic specificity. All of the articles recruited participants from healthcare facilities, such as assisted living facilities, hospitals, or community health centers. So they really looked at patients that were already seeking healthcare. And they also didn't look at its impact on caregiver burden. None of the studies used a caregiver burden index. So we're hoping to use the information found in this literature review to potentially develop a study that looks to improve advanced care planning conversations for elderly or older adults living in assisted living facilities across Pennsylvania and their caregivers. We hope to maybe include a health literacy measurement and also include a caregiver burden index to look at its impact on caregivers. And we also hope to use a more diverse patient population. Thank you for listening to my presentation.